In 1974, when I was undergoing treatment myself, one of the things that they did to help get me well was what they called detox. And by that I mean I did colonics and juicing and fasting and different things like that. And of those that I mentioned, the only one that people go, I don't know, is of course the high colonics, the hydrocolonics. And people feel that way because they misunderstand it. They've never looked at the equipment. They don't know how well it works. And a couple of things, it does not hurt. It is not embarrassing. There are no odors that are generated. And I'm getting the cookies on a shelf where you can reach them here. I'm telling you things that most guys making videos are not going to do because I'm a former patient. And I want you to detox. And I want you to get rid of the fear that usually surrounds the subject of high colonics. So the first thing I want to show you is the equipment. This is all filtered water, and they have to sign things that say the filters are changed regularly. The place is inspected. The federales come down and inspect this room, and the water basically comes out of the unit. This is what is inserted into the patient. Does not hurt. It is sterile. Everybody gets a new one. And so warm water flows into the patient's bottom. And when they start feeling full, then they release it. And through that same hose, you don't have to get up and run to the bathroom. Through that same hose, the exit happens, and you begin to move things out of your system that sometimes people say have been there for years. Some people only use the bathroom, you know, once a week, and that is not normal. That is not the way it should be. Look at babies. Babies go every time they eat. And so what happens is the patient lies down on the bed, they roll over that way facing the window, the tube is inserted, then they come back on their back, they're covered with a sheet, and then the colon therapist simply adds water or shuts it off. Takes about an hour. Again, there's no pain. It gets a little uncomfortable when you have to release, but I have done, and I'm trying not to exaggerate here, which I love to do, but I'm guessing that I've had 100 of these in my lifetime. And I think it's important, very important.